Hello, my name is Lisa Deaton. I am a Louisiana Nurses Political Action Committee contributor and a volunteer. As a nonpartisan organization, LANPAC is conducting interviews with candidates for our state legislature. We want to learn more about where they stand on issues that are important to nurses and important to the health and welfare of our citizens. LANPAC solicited input from nurses across our state, and then our Board of Trustees finalized a questionnaire based on the top issues that were submitted. This questionnaire was provided to all of the candidates prior to their interviews. I am very delighted to welcome candidate Jim Norred, who is running for State Representative District 61 of our state legislature.
Oh, that's 71.
71.
Yeah.
71. Yes, I'm sorry.
Okay.
Okay. Candidate Norred, we'd like to give you an opportunity to open up with a few opening remarks.
Well, thank you for the opportunity and to get to know y'all and get my word out to y'all as well. I am Jim Norred. I'm running for state representative District 71. That's kind of a unique district, and it's encompassed entirely within Livingston Parish. Most representative districts go across different parish lines. When they just redid the new lines, this one is the Denham Springs and Walker area on that. It goes north to Denham Springs to Lockhart Road, and on the side of Lockhart Road becomes another district. Southern Park down that line, and over to Walker. 447 is kind of a dividing line, Highway 447. So I share a little piece of it with someone running in Sherman Max district on that. But most of Walker and most of Denham Springs is within this district on that. I'm a Christian, I'm conservative, I'm Republican. I've been living in Livingston Parish now for a little over 30 years on that. My parents moved to Baton Rouge when I was 9, grew up in Baton Rouge, just across the Indian River, in a subdivision called Subdivision, Florida Boulevard. We did most of our shopping when I was growing up in Denham Springs. It was a lot closer to go there Mall and stuff. And so I'm a graduate of LSU, graduate of public school systems. I'm presently engaged. My wife passed away in 2016, and then my fiance, husband, passed away in 2019. And mutual friends kept after us to meet one another. And we hit it off, and now we're engaged on that. So the Lord blessed me twice with 2 good women in my life. Why am I running? I'm retired now. I retired last year, and it was time to try to make a difference and get back to the people in the state of Louisiana. I'm a lifelong resident of Louisiana. I served on the parish council in Livingston Parish previously, and before I retired, I had my own company and small business, consulting businesses for state governments for large healthcare systems like the Medicaid, Department of Children and Family Services, and things like that. Did that and worked that for a number of years, and a lot of it in Louisiana. The last 6 years was working on a new rate for the Medicaid system in Louisiana on that. So I'm familiar with the people in the state. I'm familiar with the state agencies. I'm familiar with the members of the legislature. Spoken on committees before the legislature, so I don't have as large of a learning curve as some of my opponents might have. And so I think that helps distinguish me from my opponents. With that, I'll ask you questions.
Sure. Our first question has to do with healthcare disparities. We all can recognize that pre-COVID, we know that there was issues with healthcare services being available on an equitable basis, not only in the state of Louisiana, but also nationally. Since COVID or during COVID, I think that light was even shine brighter. So our question is, what strategies do you have to assist with reducing social determinants of health, which are those non-medical factors that influence healthcare outcomes for our citizens?
Okay, that's a good question. Also, I failed to mention that my fiance is a retired nurse, and so she also serves as a subject matter expert for me on that and stuff. So she periodically reminds me of, well, did you think about this, or what about this, or something like that. So she'll be a valuable asset going forward. But equal access to healthcare, for one thing, is it should be everyone's top priority. It shouldn't just be a matter of people at the very top of the food chain get the best care. Everybody should have their own basic care on that. I can look in the state legislature. I can work to make sure that the things are more applicably applied on that. Medicaid, for instance, I'm familiar with that one. I'll mention that. There's close to 1 million people on Medicaid now. The eligibility and enrollment on that, I've worked on that, and there's a lot of areas that could be improved on that. So I'm looking forward to trying doing something with that as well. Environmental factors also have to play into these different areas that you're talking about on that. Air and chemical pollution in this part of the country, it's not called Cancer Alley for no reason on that. 70% of all the petrochemical products and manufactured in this nation are done and manufactured between here and New Orleans. Air pollution, water pollution, ground contamination. It is a serious factor, and it does play into the health and welfare of our citizens on that. So I worked growing up at various plants, and I'd like to work with them, not just rely on OSHA or the EPA, but actually to meet with them and try to see what's sustainable, can we do on an ongoing basis to improve the quality of the air and the water and the ground for all of us, not just just sticking to the basic rules. So I'd like to try and work with them on that. Infrastructure problems also plays an impact on the healthcare communities. The roads are bad, flooding, these types of things. That all impacts health in the communities. That's another thing that we should really be looking at on there as well. Having dispersed health clinics as opposed to one major hospital. Having smaller walk-in clinics can help free up emergency rooms for bigger, more serious events and stuff. That would be one thing that I would try to work with the hospital associations on, and trying to expand those and get more of those on there. Believe it or not, in this day and age, I found it hard to believe that I've been attending some parish council meetings, and even when I was on the parish council, some of the rural areas still have problems with just getting clean water. Their drinking water and stuff and all. Some of the water companies at the smaller cities in Livingston Parish the people are constantly fighting. You turn on the tap water and the water comes out solid brown on that. At other times they're having to have boil advisories and stuff. And also, I would like to work with the state and come up with a better way of ensuring that these smaller water companies are actually producing good, clean water for our citizens on that. So how's that?
Sounds good. The next question has to do with faculty shortage. How would you advocate, or would you advocate, for federal and state funding to support recruitment and retention of our nursing faculty to reduce this nursing shortage we see in our state?
Well, again, from talking with my fiance, and also from just recently visiting my daughter, who's in a nursing home now. She has a disease called mitochondrial disease, so she's had some issues with that and all. So nurses, they get pushed to the limit in a lot of areas on that. The number of patients per nurse is increased tremendously, and it puts a strain on the nurses, and it also causes where they can't always give the desired care that they would like to give on that, because they're just forced to do too many patients at one time on that. So I would try to hope that we can bring more nurses in to cut down on the nurse to patient ratio on that. Of course, that's going to also involve having to work with the hospitals and getting involved on that as well. Making people more aware of the health needs in general is one thing that I would try to strive to do. Teachers, I mean, not teachers, I'm sorry, the nurses get, you know, their pay, you know, you never get really paid for what you're worth on that. That would be something to look at to see what might could be done benefits wise to try and keep the faculty here, and possibly go in and talking to like the Lady of the Lake and some of the other schools that actually have nursing schools, seeing what can be done to recruit more nurses on their level and how we can get them in as well on that. That's kind of what I would target. Funding wise, if we need grants or something like this for more nursing schools or something like that, or the universities or something, you know, I'm willing to try to look into that and see what we can do to increase the capability, and also allowing the nurses to do what they know how to do. And, you know, don't just tie their hands and say you can only do this particular thing. You know, if you're qualified to do more than one thing, then by all means let them do it. You know, and trust the nurses.
Okay. The next area of our questions has to do with safety and violence. We all recognize that gun violence continues to roar through our communities. We're not only at schools, but house of worship, malls, sporting events. So what factors do you think or do you see critical to bringing these senseless acts to an end? And do you have any strategies that you want to employ?
Well, I'm an avid hunter. I grew up around guns all my life on that, but prevention, I think, is one of the better keys that we can do it. Making people aware of the effects of what happens when you shoot someone, you know, or making people aware of the consequences when you do these types of things. Teaching people to respect guns and to not just, they're not toys. You don't just try to scare somebody with or something like that. It is a last resort to be used, and when it comes to schools and stuff, no, there's no reason to carry a gun to school or church or any of these kind of places. So you go there to learn, you go there to worship, you don't go there to start fights. So we need to work on prevention and teaching people a little bit more about it. The programs can make them mandatory in schools. Gun programs make them mandatory in schools. Some of the more underserved communities, having outreach programs there and working with the local community leaders to talk about the effects of gun violence and the effect it has, not just on the victim, but on the families of the victims and stuff. And all. It ripples through the community on that, and trying to make people more people aware of that. I worked with my colleagues to try and come up with a more comprehensive training program for law enforcement to go into these areas and try to help curb some of this before it gets to that point. Try to improve their training and their awareness in the various communities to what may be triggering the discontent or the uprising or whatever. Also, gun violence is also involved in a lot of domestic disputes. Trying to work with counselors, churches, and other people to try to spot some of this potential before it actually happens on that, and then seeing what we can do to curb it on that. So that would be some of the areas that I would try to work with.
Okay. Rapid fentanyl test strips can be used to determine if drugs have been mixed or cut with fentanyl. With this important information, healthcare providers can take steps to reduce the community risk of overdose. Do you support, or would you support,
that a standard drug test does not include testing for fentanyl? I was, you know, if you get pulled over for DWI or DUI or whatever, that's not one of the drugs that's included in that they test for. It's not one of the listed ones. They test for marijuana, which won't kill you, but they don't test for fentanyl, which will kill you. It doesn't make sense. That's one of the first things that I will try to push through, that be added to normal testing when you're doing various drug testings. And talking with him, he even said that, you know, they go to to pick up a deceased person from a hospital. And they say, well, did you do a drug test? And they said, yeah, they didn't have any drugs in the system. Well, as a matter of course, they test for fentanyl afterwards, and sure enough, they have fentanyl in their system. But, they just listed him as a heart attack. They didn't know why he died, type thing. But it was an overdose of fentanyl. I was shocked to find out that that wasn't included. So we need to do that. We need to make that in there. Now, the strips, the rapid test strips, same thing. I'm all for that. The quicker you identify what's going on, the quicker you can address it and try to treat it. One other thing I found from the coroner is one of the main things that fentanyl is now being done is they're sprinkling it into marijuana cigarettes and stuff. So the effect, it hits you much quicker on that, and it only takes about 2 grains of salt, the size of 2 grains of salt, enough fentanyl to kill you on that. So we need to really strengthen the laws, go after the people that's bringing that stuff into our country. And in the rapid test strips, we obviously have got to be able to identify it as quickly as possible in order to save people's lives. So yes, I'll do whatever I can to get the fentanyl test strips out.
Thank you. The next question has to do with access to care, and you kind of touched upon it in one of your other answers, but are you supportive of actions to remove arbitrary barriers that prevent all healthcare providers from being able to practice to the full extent of their education, licensure, and training?
If you're a nurse practitioner and you've been trained and certified and all, why shouldn't you be allowed to take up some of the load off of a physician, for that matter, take up some of the slack in that area that you're qualified to do? I have no problems with that. If you've been trained in these different areas, whether it's radiology, anesthesiology, or nurse practitionering, or any of this kind of stuff, and you've passed all the qualifications, then by all means, yes, let's utilize you. Why is, with the shortages that we have and with the healthcare and the crises that we are, why not use everyone that's capable of doing it? I have no problems with that.
Okay. Our last 2 questions are a little bit more general in nature. The first one is related to what are going to be your legislative priorities if you're elected to the state legislature?
Safety and education of our kids is my #1 concern on that. Human trafficking is running rampant. The interstate runs right through us, and that is one of the main ways that it goes through there. Lots of people aren't aware that that's happening in our state. We need to address that, and we need to educate our children better. This woke stuff and all this other stuff, we've got to get back to preparing our kids for life and for success. Our competitors in other countries, they're teaching their kids to be scientists and plumbers and welders and lawyers and doctors, and we're worrying about which pronoun to use. We've got to get back to educating our kids and preparing them for life, whether it's in a college environment or a trade. Next time your toilet stops up, how much are you willing to pay a plumber to come fix it? Well, we're a shortage of plumbers even. So we've got to have our kids being prepared for life to go forward on that. Flip side of that is once they do get out of school, whether it's a trade school or college, they can't find jobs. So they go to other states. And our state is one of the only states in the South that's losing population. So we have to bring businesses back in to keep our kids here. I'm all for incentives for business, which is kind of leads into my next point, was about better business and bringing new business into the state and into District71 especially on that. Better health care for our citizens. I'm all for that. I mentioned that I have a daughter that's in a nursing home and stuff and all on that, so I'm dealing with some of that stuff firsthand, familiar with that. I'm also familiar with working with Medicaid and with the Department of Children and Family Services, as well as some of the other state agencies on that. So I want to try to improve the healthcare overall, the distribution of services, whether it's in-home or clinic or in a hospital, see what we can do to make it better on that and make our citizens healthier on that. A major interest in my district, Denham, Springs, and Walker, as you know, 2016 was a nightmare. It flooded. We have all kind of problems with drainage and flood control. I'll continue to work on those. We've got the Gummy Diversion Canal is a good start. That's just getting it going. We need to do things in the to dredge the Andy River. We need to dredge into Lake Norfolk so the water can get out of here quicker on that. Traffic flow and roads. I don't know if you've tried to get on the interstate here lately or not in Denham Springs, but it's a nightmare on that. There's other roads that feed into Florida Boulevard and stuff, which are also just backed up for hours and stuff. So we've got to improve our roads. People are coming to Livingston Parish. It's the fastest growing parish in the state. We flip-flop between Ascension and Livingston being the fastest growing. So we've got to get our infrastructure in place to handle the additional growth that's coming on that. So that's kind of what my main priorities are right now.
Great. And the last question gives you the opportunity to tell the nursing community, especially in District 71, why they should support you as the best candidate.
Well, there are 3 candidates running. They're all good men. They're all Christians. We all have owned businesses at one time or another. I think what separates me from them is my experience working with different states, including Louisiana. I worked with the states for over 20 years, implementing large systems. I'm familiar with working with state agency heads and with legislatures and one to 4 committees. I've been in practice before committees and those types of things. I've also served on the parish council in Livingston Parish. I'm familiar with the local government and their entities and how things are done there. I've helped create ordinances. I've also worked with the other members of the legislature and even the congressional delegation when I was on the council to bring grants and money and other projects back to this area on that. I think that puts me in a different position. Also, the various members that are running for governor have already said that as soon as they are elected, the first thing they're going to do the day after the election is call a special session. Well, I'm familiar with working with the procedures of the legislature and the processes and stuff, so I can hit the ground running on day one and won't be a learning curve, so I can start representing the people as soon as I get there. So I kind of think that's what sets me apart from my competition.
Well, thank you very much. Again, I want to say thank you for taking the time out of your busy schedule. And now I'd like to give you a minute or two to make any comments that you've made previously or anything new.
Well, hopefully you'll consider voting for me. Again, my name is Jim Norred, for State Representative for District 71. If you'd like to reach out to me, my cell phone number is 225-933-8855. My Facebook site is Jim Norrid, the number 4, State Representative. And that's pretty much it. Thank you for your time, and hopefully you'll consider voting for me.
Well, thank you, and we wish you the best of luck in your campaign.